If you all could first turn off your cell phones, put them on mute. And I really have to thank Conference on World Affairs for, one, putting together such a phenomenal week, and two, for putting together such a thoughtful panel. When you look at human rights and social justice issues and advocacy activism, nationally and internationally, you can look at verticals. And these 3 or 4 people up here with me today are going to be speaking about 4 in particular. They're really leaders in this space in 4 particular verticals. Speaking first, each of the panelists will be speaking for 10 minutes, and then they'll be discussing clarification questions afterward, and then we'll open it up to students first, and then people from the community to ask questions. When you talk about these verticals and activism, these 4 activists, I'm referring to them now as 4 activists on the panel. Frank Thomas Cardenas is a freelance writer and digital media producer and knows firsthand about rights around speech and freedom of speech. Tamar Heller, very much an advocate for people with disabilities, has a sibling with a disability and is very active in this space. Frank Vanderhorst is Charlie Vanderhorst is a political activist, but really in the 80s was really in the front of the stage in activism around HIV, both nationally and internationally. And finally, Liz Blake is focusing a tremendous amount of time of her life really committed to human rights around women's issues, property rights, land rights, women's inheritance rights, and affordable housing. And so I bring it first to Charlie. We'll go right down the line, and then.
No, I think Frank's
going. Oh, sorry. To Frank. I had them all listed here. And then each of them, when they speak, when I hold up this yellow card, this means you have 1 more minute to kind of wrap everything up.
Or pass it down.
Yeah.
There you go.
Okay. Hello, good afternoon. Thank you for joining us today. So I want to start by sharing a little bit about what I do in media. And right now I'm working on the Atlantic coast of Nicaragua with indigenous populations. And I travel a lot, and I've been down there for about 6 months out of the past year. And every time I go down, I'm able to do a little bit of work, and then I come back and I do some more work here, and a lot of back and forth, which is fantastic. And I love working with the indigenous populations and sharing skills and being able to foster creativity and storytelling within those spaces. But the only thing that allows me to do that is my own support network. And I think service is important, and I was excited about this panel because that's really how I see my work. I see it as providing a service to those who may not have access to it, and trying to seek out those specifically who don't have it, so that I can provide that particular service. But with that lifestyle of travel and service in other countries and in other communities, I have a security in knowing that once I'm done, I can still go home. I still have a home to go to. I live with my grandfather when I'm here in the States, and I couldn't do what I do if I had to go to a 9-to-5 job every single day, if I had to pay bills, if I had to pay rent, if I had other demands on my time, if I had children, if I had a spouse, if I had anything else, any other responsibilities above and beyond what I currently have. And I am blessed in that, I am free to travel and free to do these wonderful things. But were it not for my family, were it not for the support that I get knowing that I can go home, that there's, a place and a space for me to go to, that wouldn't be possible. And so I really do see it as a privilege. But that privilege is also my responsibility, because I understand that there's a lot of people who do have kids and have spouses and don't have, a strong family life, or simply the family doesn't have the capacity to provide, above and beyond once you've graduated college and once you've, moved out on your own, or they need help. And I have lots of friends who unfortunately never made it through. They were never able to graduate. They were never able to provide services other than that to their family and to their own needs. Which I think is important, because if we as a culture are able to shift and able to start providing that support to others in the community, and to really help on that micro level with those you live with, those in your family, those of your friends, those of your neighbors, we'll start expanding that support network, because there will be places to stay and there will be people to talk to and people to support. And if we're able to widen that network, there's going to be more and more people with free time, free capacity to support wider and wider networks. And I think that it's important, because if we don't learn to support each other first, then we can't support anyone outside of our communities. And those little incremental changes within our thought process about how we treat others, how we treat our neighbors, how we treat our family, allows for increased service. And when we're able to provide these services and expand that network, we're able to help and provide further impacts. What I think is interesting, though, is when you come from a certain culture and you're able to, have that support and stuff, you get used to that. And that support sort of frames who you are and how you think of things, which is wonderful. And it works on that small level. But when you start going out into other communities, people tend to behave the same way they would in their own community. And they think, I've gotten all this great support here, so I'm going to go export that, and I'm going to help people, and I'm going to do this, and I'm going to, make things better. But what a lot of people miss is that, the same solutions don't work in different places. And unless you have a culturally responsive approach and you do your research and you go into areas where you've been invited into and where people have asked things of you, then you're kind of going on and imposing and taking that wonderful support network you had, back home, and sort of trying to overlay it over something that might be a bit incongruent with the purpose. So what I've seen in my work is a lot of people that don't have that cultural responsiveness, and they go in and they try and help, and they give lollipops to kids, and they play soccer and stuff, which is all well and good. But what if that community has plenty of people to play soccer with their kids and suites of their own, and they need fresh water, and they need education, they need access to the internet, and they need infrastructure, and they need all these other things that aren't being addressed. Going in to help with a preconceived notion of what that help will be can be more of a detriment than an asset sometimes. And I've seen this especially in Latin America, and unfortunately with well-intentioned religious groups, a lot of times they go in with a certain idea of how they're going to help and what they're going to do, and it actually doesn't have much of an impact at all. It actually, confuses the kids, and they actually lose education time because they're, participating in these activities and doing these other things when the education is what they really need. And what I do with the indigenous communities is I help develop capacity for storytelling, for digital storytelling, and for people to take their own ideas and their native languages and their native traditions and put that into a larger framework, to put that on the internet, to provide access to that from other places. And that's what they asked me to do. I'm not going in to tell their story for them. I'm not going in to document or write or contextualize anything. Excuse me. But I'm going in as a facilitator, as someone who has been asked to provide a certain service. And I think when you do that and you go in with a specific ask, or an ask of you, you're able to have that higher impact, because this is what they need, and they're telling you what they need. You're not going in, trying to dictate anything. You're going in because they asked you to do certain things. And when you go in, you stick to that, and you teach what you can, and you learn more than you teach a lot of times. And there's the old adage about having 2 ears and 1 mouth for a reason. And it's the reality, especially when you're trying to help, and especially when you're in an unfamiliar place. And so I think a legacy of service is important, especially to those of us privileged enough with that capacity. But there's also a very real need to educate yourself and approach things appropriately. So thank you.
Hello. It's been quite an exciting week here. As you called it, an intellectual playground. So it's really been wonderful. I'm pretty lucky. You know, people say to me sometimes, oh, it's so wonderful what you do, you know, working with people with disabilities. I feel lucky because I feel that, well, I get paid to do this kind of work. So this is my job. It's not my volunteer, although some of it is volunteer work, but a lot of it, you know, is something I get paid to do. And so I run an academic department. And there's always this kind of, can almost say conflict to some extent, between the ivory tower academic and the service side and the advocacy side. And of course, you know, you get tenure when you publish research, not when you're out there in the community working with people, but when you're out there, you know, writing papers and theories and all those things and bringing in grants. Okay, so anybody who works in the university knows about that. We have as our mission breaking down barriers for people with disabilities. So it's a very big part of the mission of our department, which is called Disability and Human Development. And some of the students come in and they just want to do advocacy work, and they just want us to be an advocacy organization, you know, not just, you know, classes and all that. They want it to be advocacy. So I'm going to give you some examples of how we promote advocacy work for people with disabilities in different ways. And one of them is promoting advocacy groups. And that's been a very interesting part of what we've been able to do. Let me give you an example. There's a self-advocacy group for people with developmental disabilities, intellectual and developmental disabilities. And it's called Self-Advocates Becoming Empowered. Right now, the person who runs that is one of our employees, who's a person with developmental disability. She gets lots of support from us. We pay for all her expenses. It wouldn't happen without that. And she goes to Washington a lot, and she meets with all the important people and heads of federal agencies. It's really wonderful opportunity for her. But she came in 1990 to just a talk that we had. She was just finishing high school. And she heard another self-advocate that started a chapter of People First in Nebraska. And she got excited about that and decided to start a People First chapter in Illinois. That's like how it started. And over the years, we've supported her, and it's, you know, it's a big movement all over the country. And we still support most of her salary, and we expect her to be doing that. So that is one way. We've done research projects around the self-advocacy movement, but I feel that this fostering of self-advocacy is an extremely important role for a department, and we have also an institute that claims to break down barriers for people with disabilities. A second example, which is, I think, a really exciting one, is we have fostered a group called Grupo Salto, which I'm not pronouncing correctly, right? Close enough. And it started that we had a typical clinic that was seeing kids with autism, and we had a bilingual clinic, bicultural clinic, and we had many families coming that were Latino, and one of the social workers started a support group of some of these families that were coming. And actually, I remember I was at that time heading up that clinic, and I remember the first session we did, we tried to team up with churches, and we tried to get people to come, and 11 people said they were coming, and nobody showed up. That's how it started. Now there's 450 families, all families of kids, all Latino families of kids with autism. Can you imagine this? And this group meets on Saturdays in our auditorium. They've outgrown our auditorium. It's not as big as this auditorium, but they've outgrown our auditorium. We provide respite services. And this group has been set up as a not-for-profit, just like Self-Advocates Becoming Empowered is a not-for-profit. And we actually staff a lot of it. And we've had some kind of issues of how to do this. How, using our space, do we charge them money? They had stationery with our address. Just think about university bureaucracy and how you deal with that. And our business, you got to go to the lawyers, you need these memos. I said, do I have to do all that? Yeah, they can't use stationery, they can't use your phone, so we had to figure out all these things. And then we're writing grants. Do the grants come to us? Do they come to Grupo Salto? So, we've had to think about these things. But I can tell you that it's a real win-win because we've gotten lots of grants because we foster that group, because we foster self-advocacy. And our clinics get funded partly because we're fostering this group that is getting very well known as this wonderful group. When our clinics are in jeopardy with legislators, these families are the best advocates. They run out there, they're talking to the Latino caucus, they're everywhere. And it's a wonderful service for the families because many of these families first of all, many of them don't know English, and they meet other families. Many have these kids with autism that don't get diagnosed till really late ages because they just don't know. So it's a wonderful thing to see. Unfortunately, and I've mentioned this before, our governor just cut all the funding for our autism services, so I don't know how we'll help support this group of 450 families because we use that money to support this group. They're going to have a little banquet, but what do they bring in? Maybe $5,000 from their banquet. I don't think they've had any big sponsors yet. They've kind of relied on us a lot. So we'll see what happens. Right now, they're so involved in advocacy. There's a huge rally yesterday. They're all going to Springfield. A bunch of them are going down to Springfield to the Capitol to talk to all these legislators, try to get the money back. Well, we'll see what happens. So that's another group. A third group that I like talk about that I talked about at the NGO session it's called the Sibling Leadership Network. And this is another not-for-profit that started basically in my office with two of my students as we started to think, wouldn't it be cool if we had a national sibling leadership network of siblings of people with disabilities? And it was really cool because a lot of siblings haven't talked to each other that have a brother or sister with disabilities. And there's really a lot of issues that siblings face throughout their life. There's always been this thing called Sib Shops, or for many years that Don Meyer out of Seattle runs, and he was involved with us early on, and he does these workshops for families of young kids who have disabilities to help them understand their brothers and sisters better and also their own issues with that. Well, so we had our first national conference in Washington in 2007, and now we have 19 state chapters and 4,000 members, and we even had some federal legislation change that now includes siblings in the legislation. We sit on many boards. Now, again, the executive director is housed in our building, and we fund most of her salary in the beginning. Now because they've been getting some grants. Now their budget is up to $100,000 from different grants that they've gotten, and we don't have to contribute as much. But then there's sometimes this issue is, well, do we funnel the money through us or through this sibling leadership network? I'm still the treasurer, but eventually I'll be off of that, and I've been supporting it as part of our center. So these are just three examples of how an academic department and a research and training institute can foster advocacy to break down barriers for people with disabilities, for example.
Thanks so much, Frank and Tamar. So this has been a wonderful week for me. It's my first time here. If you would have told me a year ago that I would pay my own way to come to Boulder, leave my wife for 7 days. That man does not live on bread alone, as you know, and to prepare 8 talks, 7 of which were on subjects that it's not my academic field. I would have said you're crazy. And last night at 10:45, I was boogieing to Seoul with a nonagenarian octogenarian, Bunny. Hi, Bunny. She and I have a thing, but she is married.
So are you.
And at 6 a.m., I would be watching the sunrise with an 18-year-old up on one of the mountains here with an 18-year-old freshman at CU here. So, it's a wonderful experience. So, one disclaimer and one thing, and then I'm going to give you, I'm a professor. So professors, we give lists, and we do seminars, we ask questions in seminars, but when we're talking to a big audience, we tell you what to do, okay? So there's going to be 12 things that I'm going to tell you what to do. This is particularly to the students in the audience. So the disclaimer is, I'm not a saint, I'm not a hero, I'm actually not particularly smart, I just work hard with my limited abilities. So if you read Tracy Kidder's book about Paul Farmer, you're going to say, oh God, I could never do that. But that's not true. So that's number one. Number two is, I'm a wealthy white male, okay? We're two-physician households, so we're in the 1%. My children graduated college and graduate school without any debt. So I think it's an obligation to take care for those who are marginalized by gender, by race, by income, religion, and financial circumstances. I think it's an obligation for someone who's in the 1% to do that. So how did I come to this? Well, part of the thing, of course, is your parents. So my mother was a Holocaust survivor, and my father was a Dutchman, and they met and emigrated right after I was born, and they were appalled by the racism that was going on in the 50s. This was 52 when they emigrated. The racism in the United States and the McCarthy era, those two things. And so they were activists. So my parents joined the ACLU in the 50s. My father ran the Western New York, the whole Western New York United Negro College Fund, and we were members of the NAACP. So this goes back a long time. When I was I chose medicine for that reason, and I chose to work in public medicine and with poor people for that reason as well. So what are the lessons? Number one, this is for the students, notice things. I suggest you write a journal. So you will meet people or bump into people. So the barista at Starbucks, is she a single mother? How much does she earn? She looks unhappy. I wonder what's going on. The person who's cleaning your dorm room, do they speak English even? Does she have children? Is she taking care of a sick mother who's illegal? So if you write down things, you'll notice things. Because while you don't have to write them right then, but you'll start noticing people more, you'll listen more, you'll look at their faces, because you'll see, how would I describe Tamar? Because I want to write this down later. So I'm going to pay a little more attention to the way she looks, the way her face looks. Is she happy? Is she sad? And then you'll notice things and you say, I can help that person. Which brings me to point two, small is good too, okay? You don't have to solve the AIDS crisis in North Carolina. You notice a sad or depressed person, ask them. You look sad to me. What's going on? You might find things. There may be an elderly person in your neighborhood who has no children. Go visit them. Bring them dinner. 3, it doesn't take much. For those of you who are on the death penalty, came to the death penalty panel I was on, a friend called me up, April 2006, he said, will you write a letter to the medical board telling me you don't think doctors should participate in executions? And I wasn't particularly against executions, but I thought doctors shouldn't be in it. So I wrote a letter. It took me 5 minutes, where there's been no executions. There was a lot of other steps, but there's been no executions since October 2006 in North Carolina. One letter, 5 minutes. Okay, so point number 4, you don't need a passport. Everybody who wants to talk to me, they want to go save Malawi, those poor Africans in Malawi, and no. Look in your damn backyard. If you leave the outskirts of Boulder, where the houses are, $1 million to $2 million, there are suffering people. In eastern North Carolina, it's worse than Malawi. As much HIV, no running water in many of the houses, barely getting by. Those people need help too. So you don't have to go very far to help people. Point number 5, don't just do or talk. You got to listen when you come in there. So you've got your project, you're going to go in, and this echoes what Frank was saying, where there's a lot of white people who want to go in and they're going to save the day, okay? The Clinton Health Initiative, you know, it's a great idea, but he hired these kids right out of college. They knew nothing about public health, knew nothing about Africa, and they arrived there and they start telling people, Malawian physicians who've been doctors for 30 years, what they need to do. No, you don't do that. You ask your clients, whether in Africa or here, you say, this is my idea, what do you think? And they'll tell you, duh, you know, so it's actually called, for those of you who are academics, it's called formative research. And whether you're working in Africa or Asia or here, you need to do some formative research first. Point 6, think outside the box, okay? Unusual things. So 2 engineering students at Duke, a husband and wife team, said, gee, there's a problem with these expensive incubators, and because there's a lot of neonatal mortality in Africa, these incubators are too expensive. Why don't we take like a cardboard box, and they did more than that, and put a light bulb in it? Just a light bulb, an incandescent light bulb. They make heat. And, you know, they made it safe so the child, you know, it was a brilliant idea. Cost, what, $20 or something like that, something that's feasible to implement. Another, if you haven't heard Robert Eggers here, he's a social entrepreneur. Everyone talks about entrepreneurs and changing, you know, they're going to make all this money and, you know, Google and Facebook and all that crap. Listen, you talk to Robert, go up as a student, you listen to him, and in 10 minutes you have 20 ideas of how to change the United States. So he's a social entrepreneur. Point number 7, work with others, okay? And this is a huge problem going on, and I talked a little bit about it in the foreign aid session, like everyone they go into this service work with huge egos. So not only are they going to save the day, they know how to do it best. I'm not going to listen. If I was going to do an autism project, I would pick up the damn phone and call Tamar. She's the expert. Just because I'm the MD, you know, and she's the PhD, I would call her up and listen. I don't do liver biopsies, okay? I call up the hepatologist. So similar, you got to work with others as a team, okay? So I deal with, you know, babies in Malawi, but the mothers get pregnant and they don't want to be pregnant. So I got to talk to the reproductive health people. Well, I don't know anything about, so I call up the phone. What should I do? And let's join our, your NGO will work with my NGO, and we'll get twice the number of people. Problem number 8, think big, have a vision. So when I went into Malawi, 50% of babies born and breastfed by HIV-infected mothers were infected with HIV at the end of 2 years. And at that time, was virtually a death sentence. So my vision wasn't, well, I'm going to decrease it by 50%. No, we need to eliminate it, okay? That was the goal. You have the vision. But then, point number 9, start small, okay? We only had nevirapine, one drug. We didn't have all these other drugs to start it. So my first goal was I couldn't treat the mothers, unfortunately, because we didn't have it, couldn't treat the partners, the husbands, but I could prevent the transmission, okay? So let's just start small, stop the transmission, and then over time, you know, 15 years later, we're eliminating transmission. Going from 50%, we're now down to 4%. So think big, start small. 10, monitor what you're doing. So when we started our program, testing the pregnant women, only 30% of the women were agreeing to testing. Well, that's not good enough. 100% need to agree. This is going to save their baby's life. So I said, well, what's the problem? Well, we were drawing the blood and telling them, come back in a week. Well, but they never did that. They would go for one antenatal visit for, 200 years. You can't have them all of a sudden to come back in a week. So I said, well, let's do rapid testing. Right there in the clinic that day, you tell them, you give them the pill, you're done. We did it. We went to 85%. But I said, most people would say, okay, fine. No, that's not fine. all right? We want 100%. So then we went to opt-out testing, and we went to 99%. And the last thing, opt-out testing is you don't get an hour-long consent and have them, put their something. You say, you're pregnant, we're gonna do your blood pressure, syphilis test, look for protein in your urine, and an HIV test. Is there anything you don't want? And 1% would refuse, but 99% accepted. And it was fast. We were able to deal with more women in implant. And finally, point 11, it's a marathon, okay? You're not going to solve these problems in 3 months, okay? So you got to have the long-term vision with your NGO or your job or whatever. Be patient, work hard, keep doing all these things. And actually, point number 12, do some research as well, okay? Because so we came up, while we were doing the service work, I also did the big funding actually came from the research that helped pay for all my charitable stuff. And through that, we discovered how to prevent transmission through breast milk. Thanks a lot.
This is my last panel, and I want to echo what Charlie said about thanking you all for including me in my first CWA. It's a marathon of excitement for my brain cells. I'm going to need a long nap when I get home. But it's just been fantastic, and it's been mostly fantastic because we've got great moderators. We have awesome organizers and supporters, including Mai Hauser, who is in the audience. Thank you, Barbara, for taking such good care of me. And all Hausers. And because we're blessed with the audiences that we have and the participation. So I've got to say, this has just been one of the great experiences of my lifetime. I'm going to try to deal with service, about which I have a kind of unlimited amount of passion, and I'll try to do it with less passion than Charlie, but I don't know if I can do it. I'm going to do it from a very different perspective. I'm going to be looking at it more from a policy perspective, a funding perspective, a national trend perspective, and then I'm going to get down to on the ground to a program like the ones that Tamar and Frank had talked about. By way of background, I just retired in December from Habitat for Humanity International. Habitat mobilizes 1 million volunteers a year. The target is to mobilize within our strategic planning period by 2020, 2 million volunteers a year. I was blessed, as part of my responsibility of running our Washington office and running our advocacy campaign, I was blessed to be the person responsible for working on service issues from a policy perspective. And because the work is infinite, you kind of have to get into the rabbit holes that matter to you a lot, and I spent a lot of time in the service rabbit hole. I did it for a couple of reasons. One is the Serve America Act that I want to tell you about. The second is because of reimagining service, which I want to tell you about. That is intended to be a catchy name, so by the time I get to it, think of your version of reimagining service. And then the third is veterans. I don't look like one, I am not one, but veterans ties very much to my service story here. Serve America Act, AmeriCorps, which is a huge part of the underpinning in the United States for service, is part of something called the Corporation for National and Community Service. Are there any AmeriCorps alums in the room?
My daughter.
All right. Well, God bless you, and AmeriCorps alums are very special people. I'm an honorary AmeriCorps, and other than being a Girl Scout and Brownie Scout, it's the best thing that anybody ever gave me as a label. AmeriCorps and VISTA really underpin just an enormous amount of the service that goes on in the United States. It's through the Corporation National Community Service, which is subject to budget cuts perpetually. A group of folks got together, and it was a bipartisan group. They got together in 2006. By 2009, they'd actually passed a piece of legislation. It was a piece of bipartisan legislation, and although I almost always vote Democrat, unlike anybody else in this room I know, the bill, for I think unfortunate reasons, was renamed at its signing from Serve America Act to the Edward M. Kennedy bill. And it's not that I had anything against Teddy Kennedy. It took a bill that had been fighting, and it actually, AmeriCorps was started under a Republican president, and it was handed down as a sacred baby from president to president to president, starting with H.W. Down to Clinton, and Clinton to, the other one, and at any rate, you got the idea. And they talk about the importance of, I'm not going to tell you what to do in the White House, but take care of AmeriCorps. It was a sacred object for all of them. And to take it and label the perpetual funding, which I had to fight for, with a Democrat who frankly was very polarizing, really made the job of getting the funding for the program more difficult. And that's unfortunate. That bell will not be unrung. But people don't call National Airport Reagan anymore, so I'm hoping over time things will settle down. The Serve America Act was a very important piece of legislation. It was signed on April 21, 2009, so we're coming up on an anniversary. It did three principal things. It increased AmeriCorps numbers, roughly from 75,000 AmeriCorps members to 200,000. And it didn't do it overnight, it was over time, but that's a massive increase. The second thing it did was it caused the founding of a youth corps. That continues to be underfunded, but the Youth Corps is funded. It's more summer-based, but it does have a $500 education award, which frankly, if you live in North Carolina, pays for most of your higher education. It's a useful thing. And then the third thing is it caused funding to go in place for the National Civilian Community Corps. That's NCCC, and for those of you that do that work, it's disaster response. Mobilized, so whenever there is a disaster, big or small, NCCC is what goes out along with FEMA and the Red Cross. They are invisible to most of us, but they are phenomenal. And NCCC was basically funded through this effort. The funding for Serve America Act now is at $1.149 billion, which sounds like a lot, but compared to the need is pretty modest. And compared to what the Serve America Act proposed budget going back to 2006 is 50%. But it's still great. Serve America Act came together as a coalition because at the time, again, it was signed in 2009. The economic downturn started in 2007. The crash was 2008. By 2009, people understood that one of the core ways that we as a nation were going to get back to our economic productivity was not through employment, because there weren't any jobs, but through service. And so the idea of mobilizing service was a way to keep the economy going, keep the needs that are served by the nonprofit sector going, and it was very, very important. To that end, the Serve America Act designated 9/11 as a day of service. And so when you think back, 9/11 is now a day of service that everybody takes for granted, likely also Martin Luther King Day. But for the Serve America Act, neither one would have the strength and the visibility for a service movement. And that's had a transformative impact. My latest data on actual numbers of people volunteering, which I've quoted before, is that in 2011, which is my most recent data, 28% of the adults in the United States volunteered. 28%, that's just completely awesome. And it was 15 billion hours. As I've said before, I think those are massively undercounted because there are really no tools for counting. And in fact, nonprofits like Habitat are disincentivized for counting volunteer hours, because if you do, IRS multiplies it by $25 an hour, that gets reported, and your donors give you less money and you keep on going, I need cash, and they say, well, no, you've got all this value created by your volunteers. So counting is a difficult thing, but metrics are important. It is the segue to reimagining service. Reimagining service is an initiative that if you ever get a chance to meet Bobby Silton, who runs the GAP Foundation. I'm 5'3", she makes me look really tall, but smother her with hugs and kisses, because she was a genius, and she got Deloitte & Touche and she put the Gap Foundation funding behind a very important initiative. And she named it Reimagining Service because her view was that there needed to be real enlightenment on how service is done in the United States, and in particular to bridge the gap between nonprofits, including Habitat, but don't quote me on it, that have too many volunteers, and it always used to get mad at me. You know, I get mad on the work white site when people say, no, we don't have enough work for you. What do you mean? Put them to work. But the idea of having too many volunteers and how much work needs to be done. And the gap, which Reimagining Service actually put research behind, is that volume alone is not the answer. Volunteers, in order to be effective, need to have training, they need to have tools, and they need to have resources. Those are not free, but they mostly look like overhead. And you know that's the terrible OH and all that gets you into trouble with Charity Navigator and GuideStar and everybody else. You don't want to have high overhead. So what Reimagining Service did was did a lot of research on the value add of investing in the infrastructure to support volunteers so they would be more effective, so that donors would actually pay for it. And the way it came out was to do an examination of nonprofits and determine which ones used volunteers and which ones were effective. And it was a universe of thousands of thousands of NGOs, but the threshold was you had to mobilize 50 volunteers or more. So that was the criteria. It doesn't apply to all. And what they found was that the most effective volunteer programs are ones that had paid staff that dedicated substantial portion of their time to the management of volunteers. And further, they documented that every dollar invested in volunteer management had a nonprofit return on investment of $3 for every dollar of benefit, or 166%. For donors, that's really important. For all of us, that should be important. And the question is, how do you then get donors to try to make this investment? Reimagining Service was a coalition put together to try and get the data out, and lots of speaking at a lot of engagements. I would say the effort didn't get as far as Bobby hoped, but I'm happy to be talking about Reimagining Service today. The group the coalition that went out was interfaith, and included small and large. It included for-profits and foundations. And what they did, ooh, golly. Okay, what they did was they created a profile of what the entity was that was most effective in doing this. And it's called a service enterprise. And what you need to do is go online and Google Reimagining Service and Google Service Enterprise, because the attributes we now know, we now have a formula of what will make volunteerism more effective, and will also make the case for donors on why they should pay for the volunteerism. And I've got lots of charts you can look at later that document that further. I'm going to pretend I didn't see this for another 30 seconds, which is to say Habitat for Humanity now serves more than 1,000 veteran families a year, and we do it because the Corporation for National and Community Service gave Habitat a VISTA. The VISTA was a veteran. The VISTA veteran designed a program, and it is now serving 1,000 veteran families a year. It's a great example, and I could go through all the details of it, of the transformative value of this kind of investment that we need to make in service. When I was at the house of a veteran who had 2 limbs missing, and the volunteers from Home Depot were doing repair, and his life was transforming, he was glowing with the joy and the transformation of the change of the Repair Corps program that made his life. And he started, and he went around all of the rooms in his house. The one he was most proud of was the room with his World War II memorabilia that he had inherited from his father. He was a Vietnam vet, but all the little radios with the old-fashioned dials. But I would never have met him and hundreds and hundreds of other vets if it had not been for that VISTA. Thank you.
Are there questions, clarifying questions, any comments
Oh, I got a couple comments.
between?
Sorry, I'll make this less than a minute. I am on this panel, I'm on this amazing panel of wonderful people, and Paul Farmer, about whom Tracy Kidder, if you haven't read Mountain Beyond Mountains, you have to do it. He is one of the great volunteers and dedicated people in the world. Advocacy is the future of volunteerism, and what we need to do is think about not just hands-on volunteerism, but using the voice of volunteers. And if you want to read a book about what Frank was talking about, this is a book that's good. It's not the only one, but it's called When Helping Hurts. And it has a blueprint for how to deal with the issue that he raised about having well-intentioned groups actually doing harm or not furthering community needs. Thank you.
Any other comments for each other? There's a microphone up here. We're going to take students. Any questions from students first? Another microphone over here. And here he comes.
And please say your name first when you start.
Hi there, my name is Tyler, and I would like to thank you guys for speaking to us today. I had a great time, and I'm excited to go to my next class and share what I've learned with my fellow students. So this May, I have the opportunity to travel to Panama, and we are going with the Leeds School of Business, learning about the development of businesses in third world and developing nations. And I'm very excited to use my abilities and my abilities to teach and learn and listen to help serve other people in those areas. And Charlie, you said, I'm not smart, I work hard with my limited abilities. And one of your 12 points was that you don't just need to do, you just need to talk, or not just do and talk, you need to listen. So my questions are for Frank and Charlie. How can I impact these communities that are in need of help, not necessarily from Western civilizations, but just for each other, to do better in their communities, to raise their income level and just be better off as a community? And what are some things that I'm able to do this May in Panama that you guys have seen in the world, have experienced, and I just want to get some more of your knowledge, really.
Frank, you want to go first?
Yeah, yeah, that's great that you're going to go down there and do the work. That's good to hear. But as we both kind of touched on, just read a lot. Open Veins of Latin America. It's a great book if you want to just get a brief overview, because when you go into Latin America, you're not just dealing with individual countries, you're dealing with cultural legacies, you're dealing with a heritage of both good and ill. So there's a lot of background that you should probably get familiar with before you go down there, so you understand what you're seeing and why it's there. And part of the importance of doing this kind of work is remedying like certain deficiencies. But to do that, you have to understand where they come from. So a lot of policy knowledge, like how it has developed, what the policies have been doing to drive economic forces in Panama, and the cultural aspects. Read a lot of their writers. That would be my recommendation.
Yeah, so to echo, so yes, prepare yourself in advance to learn about what's going on there. And then, two, I mean, the good thing is you're going with an organization. You're not just getting on a plane and showing up. So the organization presumably will have some experience and will be able to guide you. But again, while you're there, you'll notice things. So you'll go there with your what you've read in books and learned today. You'll go with an agency that is presumably experienced in doing good things, although, as a sidebar, my trip in November to Liberia, it turns out I was working for a not-so-good group. I'm working now for a good group, but then I wasn't. So, but I'm assuming that your group is good. And then third thing, you'll just notice, you'll be eating, you'll go into these villages, meet people, learn about them, their lives, what are they doing, what are the diseases they're getting there, and things like that. And things will come to you. You'll become a social entrepreneur like Robert Eggers. And so you'll just realize, oh, if we just did this, then that would help these people a lot. You know, so things will come to you. You'll learn, like, oh, they're all dying. You know, you'll talk to a mother, and she says, well, my first 3 children died of diarrheal disease during the rainy season. So then, you look up rain and goes, oh, rotavirus. Are they giving rotavirus vaccine here? Oh, the Rotary Club is really good at providing funding for rotavirus. So, you know, things will come to you. So when you return, you'll have a lot of stuff. You know, you're young, you've got a lot of energy, you'll have a lot of ideas.
Thank you.
That question was terrific. I don't know if Tamar or Liz, do you have anything to add?
There's a new theory developed that I've been talking about all week, which is essentially to look at the people in communities as having assets, not what they don't have, and doing essentially an asset inventory. So when you go and you notice things, don't notice what they don't have. Intentionally force yourself and ask the people on the ground to help you focus on what they do have. That's the first thing. And the second thing is you should be asking questions and listening carefully to the answer. And then, in my mind, you shouldn't do anything unless they think it's important.
Right.
And further, if they think it's important, you should ask them how they think the issue should be solved, because most of the time they will actually know not only the issue but a good angle on the solution. Then I would add your own personal values and experience.
That's a very good point about noticing the assets. In retrospect, that's what I did when I arrived in Malawi 15 years ago. So 2 things. So with all the horrible stuff in that country, with poverty and, you know, malnutrition, everything, 2 things were working. 90% of the kids were getting their vaccines, childhood vaccines, and 90% of the women were attending at least one antenatal visit when they were pregnant. So those provided enormous opportunities for us to do other things at that time, right? We don't have to schedule another day for the HIV test. We don't need to, for the mother to see if the baby was infected, because the mother's going to bring the baby back at 6 weeks. So even if you miss testing the baby at delivery, they'll be back at 6 weeks, because 90% of them do. And then they'll come back for the next shot. So you get all these opportunities, because normally their mother doesn't have any health issues. They don't come back to the clinic. But we can treat the mother's HIV when she shows up at 6 weeks, and again when she goes for the next appointment. And then you can layer on the assets, your new program.
I have a follow-up question, if I may. How can I, while at my time in Panama, reduce my preconceived notions of my beliefs and all that, and not try and impose it upon them, but do some more of the listening aspect? Like, what are some techniques or abilities that I can utilize that I can share with my classmates?
Well, I was from your previous
Yes, of
question, and it relates to this question, is not to assume that the way we do it here is better.
Oh, right.
I think that's a really big one. I was in Egypt with the Coptic organization a bunch of years ago, and what they brought us a couple of Americans in to help them redo some of the disability services that they were doing. They wanted to set up a sheltered workshop and where people could work that had disabilities, and a residential kind of place of just people with disabilities. And the first thing was, don't imitate us, because what you're doing now is better than what we're doing. They were trying to imitate some models of the United States that actually we're trying to stop all these things. And they were going to copy it and try to do these things. So not everything we do here is a good thing to copy.
Thank you.
And last thing, you need to learn the language if you're going to go down there and really have an impact. So,
Mucho importante.
Yeah, and I would echo what Frank said earlier, which is read their novels. Find a book of short stories written by local authors, even if you don't read the language and you have to read it in translation. You need to read the way they describe themselves in their own literature, and your eyes will just pop out of your head.
I'm Gary Albrecht. Thank you very much for being role models, and thank you for giving us some ideas. So my question is, thinking back in a lot of different countries and cultures and experiences, is how do you take the synergy that you have of, and I haven't heard anybody in the audience or here at the Conference on World Affairs this year talk about idealism. So if you'll go with me back to post-World War II around the world and think of hope and idealism, and fast forward now, in which we are talking about huge resources, time, money, volunteers, national and international agencies, and a huge amount of work, waste in terms of administrative costs, duplications of effort. We're in the field with Médecins Sans Frontières, we're in the field with the International Red Cross, which is not the American Red Cross, and so forth. My question in that context is, how do you focus time, energy, and resources on a real problem, at least you think it's a problem, that you want to ask people, what is your problem? And do that in such a way that you aren't co-opted, either by a church, a religion, a political party, a generation of people, and so forth, so that in Peter Singer's new thinking, we are going into the field with effective altruism.
Boy, we need another week on that topic. You know, it's a very complicated issue. I think one of you others, I can't. It's just complicated. I mean, I just try to keep my head down and go for it. So for the idealism thing, let me just tell you, in the hope and idealism, 70%. So in the old days, college students would, you know, they go to Europe, Paris and London, they study Shakespeare and things like that. 70% of the undergrads at UNC go overseas for long-term projects working on service things in resource-constrained things. So the idealism is there. There's no question. And they volunteer around the state and things like that. The students do wonderful things. So I'm not concerned about the idealism. And I think in the co-opting thing, I'm going to be a little less strong than you on that, and go back to my earlier point that, you know, many hands make light work. You know, so the Catholic Relief Services at some of these countries, and the reason that the President's emergency program for AIDS, malaria, and TB worked so well, one of the things is that the money was not just funneled to the governments, okay? They picked within the countries, agencies, individual doctors or midwives, religious, non-religious, US-based, European. They were indiscriminate, but they had to be competent and be doing good things. And because of that, they've improved the survivorship in the countries that they target with dramatic. We've never had a benefit like that in these countries. So I think you don't talk as the way long ago the president of Uganda says he went to the church. People say, you talk about this, we'll talk about condoms, okay? And you get them as allies and don't get it as divisive things. And, you know, frankly, from my perspective, PEPFAR was set up by George W. Bush. Everything he did, I hated. But this program, no president has ever done anything as impactful as that. Not Clinton, not, you know, and foreign, certainly not. Clinton spent $50 million on one trip going to one country in Africa while AIDS was raging. Bush solved the problem. Yeah. So I don't mind working with him if he's going to do that. And now he's tackling cervical cancer, and he's eliminating that in Africa. So continuing on, he's doing it quietly. He doesn't make as big a splash as Clinton does. But he's, again, affecting things. So the man, I abhor everything he did, but he did that good, so why not work with him?
Yeah, I'd like to echo what Charlie said about PEPFAR. Habitat's programs in Africa for years were PEPFAR funded. That's a little, and it was because PEPFAR funds were flexible enough that we could build a house for child head of households, so a 14-year-old girl, who, by the way, already at that point had her own child, but she was willing to raise her own siblings when both parents had died of AIDS. and supported by a community network. That was PEPFAR funds, just brilliant, and I completely agree with that. On the co-opting, I'd like to have a slightly different angle in the response, which is that you actually need to respect, or try as hard as you possibly can to respect the government that is in place. And I think you kind of sometimes have to hold your nose and not worry about being short-term co-opted, because to the extent that your effectiveness requires some level of cooperation with these stinkers, but it's all about the service delivery, not about your politics and your values, moving forward may sometimes require you to hold your nose. And in Haiti at the moment, I'm going down week after next on my 53rd trip. Haiti's a corrupt place at many, many different levels. I've been blessed to be able to work on projects that are actually impacting. We've already got a count of more than 50,000 families directly impacted by habitat, and I'm working on another project with much bigger impact. If I didn't work with the government, I couldn't do what I'm doing. Now, President Martelly will be out February 7th, so you have to kind of, I have to keep aware of who else might be and make sure I'm not making any enemies. I think trying to stay neutral, like bipartisan, is a good role, but worrying about co-opting may be a distraction that's not important for service delivery.
Yeah, I agree.
Okay. First and foremost, I want to thank you guys for coming and speaking to us. It's been pretty interesting to see, for lack of a better term, 4 branches of service kind of coming together and talking at once. So found that pretty interesting. My name is Adam Bojeri. I'm a 5th-year student here in Econ and Engineering. To give you a little bit of background about my question, where it's coming from, I was the president of a branch of St. Vincent de Paul Society for 10 years, and I've worked for Sentinels of Freedom for 3 years. So first and foremost, if you could repeat 2 numbers for me, it was the percentage of adults that volunteered and the amount of hours that were reported?
It was 28%, and it was 15 billion hours, and the data is from 2011.
Perfect. So my question is, based off of that, have there been any reports or studies on kind of how big that shadow volunteerism is? I mean, has anyone ever said or tried to count even the percentage that's missing in there? Because I myself have seen and honestly been a part of a little bit of underreporting on those hours for the same reasons. So I definitely see where that problem comes in. I worked several thousand hours over the years that I never reported myself because I wasn't necessarily a volunteer. So I'm just kind of curious if anyone's ever tried to measure that or even had a grasp at it.
There are some efforts to try to do it. I didn't find any that were more definitive that where I thought the data were reliable. The Corporation for National and Community Service is the repository of the service data, and so I would think CNCS related research would probably be the best source. And getting the IRS to get away from the $25 attribution of the hourly rate would make a big difference, and people could come out of the closet, but that's not going to happen soon.
Great, thank you.
Hi, my name's Tim Wagner. How do you feel about organizations that recruit volunteers and then charge them a fee to be a volunteer, maybe $2,000 to $4,000 for a couple weeks of service? I'm thinking of two that come to mind. Is Earthwatch is one, and African Impact is another one.
So I'm not familiar. What was the first one?
Earthwatch.
So I know where that does happen is that often with high school students and sometimes college students, and I can actually understand where that's coming from. So they usually are very short term, so they're not going to have any impact. They know nothing. They don't speak the language, and they're basically not going to help. So what it is that they're getting it's more important for them than the people in that country. So I'm always getting people who said, "Oh, I want to go to Malawi," and I say, "Well, we'd have to hire a translator for you. You're not going to be driving there. We'd have to put you up, and it's expensive." And so the answer is, get your MD or RN or your MPH, some skills, and then fine. Yes.
I know my daughter went to one of those when she was in high school, so she'd have something to put on her resume, on her application for college. And sure enough, her whole application to college, she had all this stuff about the great things she did in Belize, which was 3 days where they went into a hospital and did something there.
Yeah. Habitat thrives on charging volunteers. We have what's called a Global Village program. It's in 42 countries. And you can go on the website for habitat.org and you can decide where you want to volunteer. And it used to be that we just charged something, and it turns out once we did the data research, it was at a loss. So we were actually underwriting people going. And as Charlie said, the houses would be built anyway by local labor. The volunteer building isn't really the point. It's the whole cultural exchange. It's a much longer relationship building. It's the most fabulous thing to do. If anybody wants to go with me to South Africa in July, I'm putting together a trip for South Africa in July. We are actually evolving to charge more. And the reason is a portion of the money had always gone to the local program as a unrestricted gift to the local program so that they could do more good work that they valued. We've upped that, and then we're using crowdsourcing and social media as a way to have people do a little fundraising campaign before they go. Give me $25, I'm going to South Africa, or I'm going to Paraguay or wherever, and try to do it so that people will get the excitement and then people coming back. I took my nephew to Bogota last summer for one of these things, and it's a longer story than I have, and the yellow card will come up, but he's getting married in September in Cartagena. So these trips are really important, and paying for them is valuable.
And so I guess I want to add like lesson 13 for the undergrads, getting a skill. So, and it can be anything. They need agronomists, they need engineers, water sanitation people, electricians, builders, doctors, nurses, public health people. So get a skill, and learn the language and things like that. And then you can help. It's all great. In the meantime, do get your service chops up here in rural Colorado with, poor illegal immigrants. And you get your service chops. It's local, maybe not quite as exotic. You'll learn some Spanish. And then you can go with Frank. And he's going to want you because, A, you will have been experienced, and he doesn't have to, and then you'll be a nurse or an agronomist or a water person, and he won't have to be your mother.
There's a difference too between these kind of organizations that have been talked about, and that skill is important because when you're able to offer something, it really does have a positive impact. I think part of the issue that the gentleman asked about was more like hostels and hostel related work where they have an organization that works with the local school, painting murals or art with the kids or something like that. So that is a real problem, especially in developing nations, because that creates sort of expat enclaves, which become insulated from the local population. And it's the same economic exploitation that would be, somebody coming in and building a company. And a lot of people, especially in resort towns, and the eco lodge movement has really been wrapping up, are expats looking for cheap land and, a way to have fun, honestly. And that's fine, but you're also negatively impacting the communities and creating segregation and some other, cultural impacts that you may not be doing if you were going with skilled labor and a specific purpose. So I think that economic exploitation is very real.
Can I jump in real quick? Sorry, I'm gonna do a little. Oh God, I forgot what I was gonna say. Well, anyway, I want a little public promotion. On top of the topic you guys were talking about, there's a local company called Growing Colorado Kids. It's
We need to frame it into a question.
Sorry?
If you could frame it into a question.
Okay, well, it's not a question. It was just a local, when you guys were talking about local things you can do. It's a specific local one that's really big on like the low-income families and that kind of thing.
Good. Thanks.
So it's called Growing Colorado Kids. That's all. Sorry.
Hi, my name's Richard Barahona, and first of all, I'd like to thank you all for coming here. It's been great listening to you and taking in all the knowledge that you've given us. My family is Guatemalan. They're Guatemalan. I'm first generation American, and whenever I go back to Guatemala or visit, seeing just the necessity that is there, it really pushes you to want to do something. And I know that you have echoed a lot that sometimes a lot of people want to go and help, but sometimes they can hurt even if they want to help. And I feel that that's a message that is starting to become to spread more around a lot of these communities of a lot of Americans who wish to go to other countries and help. So how do you bridge that gap between not being discouraged by other people and being told that there really isn't much that you can do and actually doing something?
Well, I think there's a tremendous amount you can do, and especially if you are Guatemalan, that's your history, that's your heritage, that's your legacy. Even coming here, that's sort of your responsibility. You've been granted all these benefits being here, and I can see why going home, sometimes you see what you have here and the disparate nature of what they have there, and you wanna help. So I think you find a skill and you understand that it's not going to be overnight and it's not going to be quick. As was said, you just, you've got to go in and I don't know if you know the language or not. You go in and you work with the community and you talk to your family and you talk to the people that are there and you see what they need and then you develop those skills. It's a long-term, lifelong building process, and you're not going to realize the impact you have until the other side.
Yeah, I think you've got more skills than you know, because based on your heritage, like Frank said, and your language skills. So, and as Frank said, you do your needs assessment. I mean, that's a formal term. You go in and you start talking to people and finding out about their lives and what, are they getting childhood vaccinations and are they doing this and how's the food situation when it's dry and things like that. And you'll learn things and you'll see ways you can help, sometimes concrete and short term and sometimes long term. They'll come to you.
I
Yeah,
think also,
I'm sorry. Go ahead.
being a first generation in this country, I wouldn't assume that you're too similar in that you're more American, probably from having grown up here. And so there's always that little bit of culture and identity issues of sort of, are you American, Guatemalan, and trying to understand what the culture is there.
Yeah. The other comment I would make is if and to the extent you go under the auspices of an organization, which some of them are really great and it's a very effective way to go, I would look at the mission of the organization and see if it is an organization that's committed to empowering people instead of giving things away. And what we need to do as donors, this is the most generous country in the world, what we need to do is commit ourselves, redefine our philanthropy and generosity outside the United States to be focused on empowerment and capacity building, and not just talking about doing that, but actually doing that. And there are some NGOs, Habitat is one of them, but there are others that are very effective about building back or building up the capacity of the people in the community, because what you want as a result of the long-term intervention of the organizations you become part of, for them to have communities stronger and not need them anymore and move on someplace else and essentially work themselves out of a job on a community by community basis.
The last thing I'd add is that you can't really listen to us or anyone and have us tell you how you want to do things. I mean, if this is what you feel you want to do, you have to own it and just go for it, and don't really, wait for anyone to tell you that you can or that you should or how you should. You should really take the time and start by thinking about what you want to do to help and own what you want to do. Just think about how you do it.
Thank you.
Are there any other questions?
Charlie, you were talking about healthcare providers, and it seems like there's a lot of opportunities. I'm a nurse, so that's why I was thinking I never thought of it, but just wondering what you can do specifically as a healthcare provider to go over the
So she wants to know. You're in nursing school, or you're already a nurse? RN. So there are multiple, like the Global Health Corps, the HIV Corps, and things like that, where you can actually go. You don't have to volunteer. They'll actually pay you. You're not going to get rich, but they will pay you in housing and things like that. There are many opportunities like that. So if you Google, but I think one is called the Global Health Corps and the other one is the HIV Corps, something like that. But there are a number of people that can do it. Doctors Without Borders would love long-term things. Doctors Without Borders is a superb organization. They take really good care of their staff. They do best in logistics, and they mostly do short-term things, a lot of things, but they also have these, I think there's about 6 of them, long-term permanent HIV clinic situations. One's in Kailicha right outside Cape Town. There's one in Malawi, for instance, and those are good things as well. So.
What is short term, like a month?
Well, a lot of places would be reluctant to let you do short term, again, because it's not worth their while. I mean, if you completely pay your way, they might let you, but even Doctors Without Borders would say, well, you're not going to be familiar with the way they do things, and then they'd have to train you for a month, and So surgeons, so my friend who's a surgeon, he goes for 4 to 6 weeks because they desperately need surgeons. But for an RN and a regular doctor, they would want them longer term.
There are some smaller ones. There's an organization that's called Partners for Care that goes to Kenya, and it's run by an RN. And she takes people for a week to 10 days, and she does treatment in the villages of jiggers and some other things where you can actually make a pretty quick intervention, and it makes a difference in rural Kenya. And she would be happy to have a week commitment. So I think there are ranges of them, but anyway.
Terrific. Thank you all for coming.
I see trees of green, red roses too.